many techniques, including amputation, anesthesia, and facial reconstruction surgery. They also built hospitals as well as on-field treatment centers, which are similar to ER systems we have today. Back then, they thought these types of surgeries were extremely high-tech, but now they seem useless and unsanitary. Amputations were the only way soldiers would be able to survive on the battlefield. 174,000 Union soldiers suffered painful wounds, and 30,000 had to get amputations, and 3/4 of them only survived. The chance of surviving counted on where the wound was. If it was in the forearm, there was a 14% chance of survival rate. But if the wound was in the hip joint, there's an 88% chance of survival rate. If amputations were delayed more than 48 hours, then the wounded soldier would get blood poisoning. Blood poisoning is when microorganisms such as toxins get in the blood, which causes a disease called septicemia. This was actually a very painful way to die. It was best for the amputation to start within 24 hours. Battlefield surgeons eventually took no more than 6 minutes to get each moaning man on the table. They would apply a handkerchief soaked in chloroform or ether and make a deep cut. Union surgeons became the most skilled limb hackers in history.
There were two main methods of amputation in the Civil War. If time was a restriction, mostly when treating soldiers on the field, most doctors returned to the flap method. This consisted of cutting 2 flaps of skin, muscle, and tissue at a downward angle, then cutting off the bone. The doctor would then proceed to pull the 2 flaps over the opening. Transporting after the surgery was very difficult because the wound was more prone to gangrene and hemorrhages. The circular method was much safer, but more time-consuming. The surgeon would roll up the skin and muscles surrounding the wound and then cut in a circular motion around the limb. He would continue to roll the cuff that the skin and muscle resembled back down and then sew it together to create a stump. There were many tools that were utilized in the operating room, which was more like a tent, such as a variety of saws and knives. They would also tie off the wounds with horsehair or silk. Before bandaging the stump, the surgeon would scrape the opening to prevent regrowth, and then wrap it in plaster, remembering to leave a drainage hole. By the time the patient was awake, the surgeon had already moved on, ready to hack off another limb.
During the Civil War, the experience and training of the doctors wasn't well regulated. The Union Army had only 98 doctors registered, and the Confederacy only had 24. Both armies were willing to take anyone who considered himself a physician. Most of these new doctors carried around a copy of a military surgeon manual that had been written by Dr. Samuel Gress. Infection was a huge problem, and to make matters worse, doctors thought pus was a good sign. They called it laudable pus. Plus, they transferred it from patients who had it to patients who didn't. Doctors didn't understand germs or how they carried and spread. As a result, they violated nearly every rule about sterile technique that we use today. Infection and disease was so common that soldiers didn't have faith in doctors. Sometimes soldiers felt that limbs were amputated needlessly, or simply they didn't want their arm or leg to get cut off.
As Ellie has already mentioned, it was common for surgeons to use ether and chloroform on the operating table. Although anesthetics were already in use before the Civil War, they were of great use during the fight as well. Previously used as a treatment for ailments such as scurvy, ether and chloroform were scentless, highly flammable, and clear liquids that could be used in gas form to numb pain while leaving the patient conscious.
Charlton Bergen of Maryland was in terrible shape. The 20-year-old private had survived pneumonia, but the mercury pills he took as a treatment led to gangrene, which quickly spread from his mouth to his eye and led the removal of his right cheekbone. He was willing to try anything. In a pioneering series of operations in 1862, a surgeon from City Hospital in New York used dental and facial fixtures to fill in the missing bone until Bergen's face regained its shape.